August 16th, 2019. Copa Heatlh, with support from the Arizona Department of Health Services, held its 6th annual Emergency Preparedness All-Day Conference titled Vulnerable Populations, Planning for a Pandemic. The conference was based around the United States Department of Health Services and 11 states working on a tabletop exercise that simulated a new virus previously undetected with no vaccine. The exercise was designed to coordinate efforts nationwide in the event of a worldwide pandemic. It was called Crimson Contagion.
And so in Crimson Contagion, what we're finding is that yes, there's going to be a medical response. You could anticipate that now in this phase, there's going to be a significant amount of hospitalizations, and there's going to be a significant amount of deaths. Well, in a pandemic response, it's definitely we're in this together. It's not just to a certain section in a certain area, in a certain group. It's going to be the entire state is going to be impacted.
But here's how we would work to provide vaccines or antivirals to you in the community.
How do we reach those folks that are in the community, and how do we communicate to them at a level that they can understand?
Speaking the same language is critical so that we can get through the emergency. Once you get past the communication issue and we don't have to guess about using codes or using acronyms for certain things, we're speaking the same language. It just makes for a much more effective form of communication.
America's pastime and America's passion converged as summer turned to fall. Fans all over the world came and watched. The autumn leaves gently fell, and suddenly we saw witches and goblins and trick-or-treaters. Families gathered to love and to feast. Crowded malls with holiday revelers. And in a blink of the eye, the year was new, fresh with hope and good cheer. Crowds gathered everywhere. And then everything stopped. Coronavirus, novel coronavirus, COVID-19. Empty shelves, social distancing, stay home, subways, airports empty, stores and restaurants closed, stimulus checks, financial meltdown, schools and houses of worship closed. 3 times the losses we suffered in Vietnam.
I felt COVID was certainly a challenge once it hit in March of 2020. And then when COVID-19 unfortunately approached us, we were able to create a task force fairly quickly and be able to respond to the daily challenges of COVID.
Yeah, we had never really thought about the idea of needing an emergency plan, certainly not for a pandemic. And the nature of what we do, it probably wouldn't be as applicable as it certainly is for someone like Copa. So, yeah, I don't know that the word pandemic had ever crossed my mind other than in the movies.
Prior to the pandemic, we actually did not have a pandemic-specific response plan in place. It was only after the pandemic occurred that we created a very specific COVID-19 pandemic plan. And to this day, I don't leave home without it. As a matter of fact, I carry it with me everywhere I go.
We were part of the Copa Health conference the previous year, and in doing so, we planned for a lot of things. And in our emergency book that we have a chapter on pandemics. So we were prepared if a pandemic came along, which on a priority of 1 to 10, we thought it was about 2.5, and might be a bad case of flu. We were not prepared for something no one has ever seen before.
Did we explicitly have something for pandemics? That was part of the overall plan, to be able to handle any emergency, but we're really geared towards fires and things that in Arizona that happen every year. Influenza, different things like that. Pandemic, it was in there, but never been used before.
Here at Pastor Cristo, we really had no emergency plan for anything to prepare us for this entire COVID-19 thing. You know, we have plans for what do we do if a shooter comes on the campus, what do we do if there's an emergency with one of our guests, but as far as this epidemic, we had made no plans for it.
We didn't have a plan in place, for the emergency. But we have protocols from OSHA. OSHA, since 1970s, they were preparing, workplaces for the pandemic. But we didn't have a plan specifically for the pandemic. No, we didn't have one.
So prior to the pandemic, we had an emergency preparedness plan in place, and it mentioned pandemic, but we weren't specifically prepared with all of the equipment that we needed.
The Arizona Statewide Independent Living Council had a emergency preparedness plan that addressed pandemics. However, knowing now kind of things that we didn't anticipate for COVID-19, we realized that we focused on like swine flu and our imagining of a bad flu season, and that was quite different than our experience with COVID-19.
At my university, there were a lot of plans in place for dealing with emergencies and making decisions about how to move forward if there was an emergency, but really not for a problem like COVID.
Prior to January 2020, our organization was prepared for emergencies because at Child Crisis Arizona, crisis is our middle name. So while we're always prepared for emergencies and we are quick to think on our feet and be able to respond to whatever the emergency is of the day at our agency, we weren't specifically ready for a pandemic with all the PPE and thinking through all the programs that we would need to suspend and modify and be able to pivot.
Well, I felt we were really prepared because every October we go through flu season, and you have infection control procedures, you have things of that nature. We also have the nursing home incident command that we have put in place. Little did we know that COVID was going to throw us some curveballs.
So we were pretty much totally unprepared for COVID-19. We had really not thought about what we would do or how we would change our plans ahead of time. So it was really, once it happened, we had to think about what to do.
We protect our residents from 5,000 different diseases. So we thought we were in very good condition for COVID. I mean, how bad could it be? It's a bad case of the flu.
I thought that this was going to be nothing, that this was going to go the way of Ebola or SARS, and it would become a news blip, and that would be it. So we were not prepared by any stretch of the imagination.
I felt COVID was certainly a challenge once it hit in March of 2020. We had already been thinking about ways in which we could have a formal response related to a pandemic, not only just hosting the conference last year. We have an infectious disease control officer. We have a full medical team that's really designed and dedicated to making sure that our members and staff are safe, again, while maintaining and continuing to operate our services for all of our members.
We were prepared for a pandemic. And it seems like odd that you're saying, yeah, but you didn't have a protocol in place. But we take care of kids. Then since the beginning, we knew, since 20 years ago, we started putting sick patients in another living room, healthy patients on the other side. And when this happened, in January, we said, well, we are not prepared, but we were a little bit prepared.
Well, prior to January 2020, I had felt really good about our plan. We were very fortunate that we have our staff already work from home without an office. So we were very comfortable with the remote work environment already. And the centers for independent living already had plans for remote work in place.
I wasn't concerned because it happened before, the pandemics that sometimes you didn't realize, how dangerous they were. Then everybody was kind of like laughing. It was a lot of memes, a lot of stuff on social media that I didn't believe that shouldn't concern. Even it was one meme that it was a Corona beer. And then it was, the other beers, running around. But I wasn't concerned. I think, this should pass.
In the beginning, when people were talking about COVID-19, I personally, my wife and I have been married 50 years, and I was hoping that it would be a short blast. It would take a few weeks. We were married in May. I'd already paid for, to me, an expensive trip to Italy and to Paris and meeting friends we hadn't seen in years. So I thought by May, certainly by May, this will all be over. You come in, the flu season ends even in the worst seasons at the end of April.
So when I first learned about COVID, it was the end of January, and Teresa Enert with the Arizona Department of Health Services came over to the Marriott where we were having a seminar, face-to-face seminar, and we were talking, and she said, I know I said I was going to introduce myself and introduce the program and things like that, but she said, I can't do it. We've just opened up the Emergency Operations Center. And I'm like, what's going on? We're not in fire season, what's happening here? And she said, COVID-19 has just hit the United States, and we're keeping a close eye on it. And that's when started to hear the news about Lakeland, Washington, and about the skilled nursing facilities and the assisted living communities that were getting hit up there, and it just kind of mushroomed from there.
So in the beginning, I was not very concerned about the coronavirus, COVID pandemic or anything. As a matter of fact, when it first was starting, I remember myself walking around telling jokes around the coronavirus. I would walk up to people and say, hey, did you hear that joke about the coronavirus? And they would say no. And I'd say, well, I can't tell you because I don't want to spread it.
So we had a special event in February, and we started worrying about who was going to attend this special event. Was the 20% no-show rate that typically we all see at special events, was that going to be even higher? And were people going to be thinking about bidding on trips to Japan and other places that we had talked about? So we were thinking about those things, and we were getting ready, and we were preparing ourselves for a lower amount of money that we'd be able to raise.
With benefits of being a professional, I already knew the risks of any kind of facility that housed individuals. And that could be a nursing home, assisted living, a temporary location, that could be a prison or ICE detention, a wide variety of facilities. But anything that has a large number of people living in the same area has a lot more risk of a virus spreading.
My wife and I had a trip planned to Hong Kong for early February, and I remember when I first started hearing about it in early January, I thought, wow, Hong Kong's kind of close to China. My wife said she heard that Hong Kong Disneyland closed, and she says, well, if Disneyland's closing, I'm not going.
So initially I would say not that concerned, but certainly within the first 2 to 3 weeks, once we started to see the cases increase day after day in New York, our task force realized that we needed to make sure that we had very robust policies and workflows and protocols in place so that we could continue to do the great work that we do while making sure that we are safe.
So when it became evident very quickly that nursing facilities were going to be particularly hard hit, we met with the association and began talking about a couple of different options.
I mean, once it gets into a skilled nursing facility, it becomes a wicked killing machine. It just decimates the whole area, especially if you don't know it's there. And that's the problem that we had from the very beginning. We didn't know who the enemy was, and we didn't know what the enemy could do.
Washington State had a couple of nursing homes that had, the spread of COVID-19 was very significant, and the mortality rate was very significant. And with that, I became more aware of how different the fatality rate is and the risk is between someone who is my age at 33 versus someone who is 65 and older.
The day I realized this pandemic was bigger than I had imagined is the day I found out that, or was told at that time, asymptomatic employees and residents could be the most contagious people that have COVID. How can I protect myself and my residents from a disease I can't detect? I became nervous at that point.
In mid-February, late February, I started having daily conversations with our chief medical officer at Copa. And those conversations were related to this virus. And I must say that he, out of anyone that I had conversations with during that time, was the only person who said, this virus is not going anywhere, it's gonna get worse. And the longer we wait related to our response and the policies and procedures we need to go ahead and implement, the harder it's going to be on everyone, and we're not going to be able to keep everyone safe.
So I realized that the pandemic was as big and serious as it is currently when we made the decision to shut down one of our sites completely for multiple days. It really hit home then that we're sending our employees home, we're shutting things down, we're not serving our participants any longer. So just from a delivery of care perspective, from a compassion perspective, and from a business perspective, things got real for me on that day, and I will never forget that day to this point.
Yeah, as I recall, it was about mid-March that we really realized we had to do something. I think it was probably about March 8th or March 9th when we decided to shut down the dining room and no longer have congregate meals in our dining room.
You know, the first time that I realized that this one was something that is for real and was going to stay for a while, it was March 18th. And all of a sudden I go to a restaurant and it's empty. And I told my wife, you know what? This is for real. This is something that we should start, making sure that we're ready for it. And that's exactly when I realized, how big was how big was this thing, worldwide, not just in the U.S., but just worldwide.
So we decided early in March, and watching the news and seeing all the new cases, that we would need to suspend operations in our early education program. And so we need to modify. So we met as a team and we figured out that these classrooms that we're in now, they were full at the time. And we said, how can we continue to serve these children and these families? And we can't do it in the classroom setting anymore because it wasn't safe. So that was early on in March.
At the, so probably that first week in March when you first started to hear about things closing down. I mean, I guess when it really got my attention was when the NBA just all of a sudden shut down, and like, wow.
We learned from the Washington model up at the Lakeland, Washington facility that about 40% of your staff just leave day one because they don't want to get sick, they're fearful, they have family members to take care of, and they don't want to bring it home to them. All of these, the myriad of reasons.
As soon as it went through my building that a resident had died with COVID, I lost my workforce. I lost 25 people. Not that they aren't caring, They do care, but for their families.
I would say one area that we were not prepared for, like many organizations, had to do with getting our staff prepared to work remotely in a very short amount of time. And I'll give you one example. We had a telehealth strategy at Copa where we were going to go ahead and implement and launch it in 6 months. This was pre-COVID. We had set up a timeline where we would chip away at different goals every 2 weeks. But unfortunately, when COVID was amongst us, we rolled this out in less than a week. It was 4 days, to be exact, where we had to get laptops in the hands of all of our docs, all of our counselors, all of our frontline staff, and anyone who could work remotely. We went ahead and set them up to be able to work remotely.
Then as soon as the pandemic started, the first thing that I realized is if we don't establish a telemedicine workflow, we're going nowhere, because patients, we have a huge responsibility. And the biggest responsibility is making sure that our patients have the best quality care.
So we had a pretty expansive telehealth benefit heading into the pandemic period, but it became very apparent very quickly that we needed to do more once the pandemic hit and people were really faced with needing to stay in their own homes in order to maintain their health and safety.
And without telemedicine during the pandemic, we were not able to do that. Then for us, for Happy Kids and Feliz Care, it's just the biggest deficiency during that time was telemedicine.
So in the early stages of the pandemic, what was very confusing and was part of our big issue was that we didn't have clear guidelines coming from anywhere. We were hearing wear masks, don't wear masks, they're for us, they're to protect others. It was very unclear. So that vagueness and lack of clarity in the beginning, I think, was very much a challenge for us trying to figure out exactly what we should be doing. We didn't realize how much we would be learning about this virus.
You know, the events, I think, is probably where we just had never dreamed that, my biggest worry with an event prior to 2020 was always the weather. That was the only thing I couldn't control. I've now found something else I can't control.
I would say that the biggest deficiency that we had at Child Crisis Arizona was the amount of supplies and things on hand. So like every family, we didn't have enough canned goods, toilet paper, cleaning products, and especially PPE. We had some, but we didn't have enough face coverings, gowns, and other equipment that we needed.
Probably looking back on it, just not having contingency plans or just not having a plan in place. We knew we wanted to feed people, but some of the programs, handing out IDs and doing those types of things where we had to get up close to the guest in order to fill out the paperwork, we did suspend those.
The 2 to 14-day window of being asymptomatic before you develop symptoms and while you're contagious during that time, that was very difficult.
Whenever we put the restrictions on visitors, it was only by cooperation.
And then the guests are another thing, because the guests will come, as I mentioned, a couple hundred guests at one time. They're outside the gate and they are congregating. So we can go and we can ask them to keep their distance. We can tell them we have masks to provide. But a lot of times, once they're out the gate, there's not a lot we can do about it. So that's an issue.
I sell socialization, I sell nutrition, and I sell security. That's a three-legged stool, and whenever you cannot socialize, it impacts your health. So at the one point, we're protecting the entire nation by social distancing, but my residents are impacted heavily whenever they don't and cannot get out even to talk to their neighbor.
The government was not giving seniors the priority. So whether it was the federal government or even the state, they were giving the priority to the hospitals. And the hospitals still had elective surgeries going on at that time. So they were sucking up all of the PPE that was coming into the state, and none of that was getting dispersed out, or there was none of it going to any of the assisted livings or skilled nursing centers around. So that really tightened things up.
I think one of the unique challenges for our organization is the demographics. We serve demographics that they need to go out and work. Then how can we help those parents to understand and educate them the importance of staying home when they have a need to provide?
But one of the other flexibilities that we appealed to CMS on really early, which I think has been critically important, is in an instance where a family was uncomfortable with an outside caregiver coming into the home, we were able to offer reimbursement or compensation to parents of minor children who were able to provide care over the course of the pandemic period or the public health emergency.
And so what we had to do is we adopted an all hands on deck mentality, like many of the nonprofits, and some of the other programs that we suspended or we had to do a pivot in needed to come over and support the emergency placement programs and work inside of the homes or support just shopping. For a while, not being able to, get multiple packages of chicken every time you would go to the store with all the children that we're providing for, that was hard. So we would send 4 or 5 staff out multiple times a day just to get enough food for the day.
I think we just, we felt a little lost. And then I had a conversation with one of our consultants, Mike Merchant. He had some great thoughts along the lines of, it really fit well with our nonprofit institute. One of the things we talk about in our nonprofit institute is, first of all, what can you do in your organization to help things go right? But just as importantly, what kinds of things do you do when things go wrong?
Some of the unique challenges for Copa really had to do with hearing some of the disheartening stories, I think related to both our members and our employees, because we took such a very intimate approach with our response. We know every single member and every single staff who was affected by COVID. Some of the stories I personally heard were extremely disheartening. They're continuing to be disheartening. We're very challenged with the amount of loss and grief that our members and staff have gone through. And so I was not prepared for that in my career. I don't think any of my colleagues, when I speak with them, have been prepared for something like this. As it relates to the heaviness and the loss that everyone feels for losing someone due to this virus.
So our primary pivots were definitely in the area of telehealth and telecommuting. It was kind of funny because just a few months before, I remember having meetings with our team talking about how we're going to leverage telehealth and do all these wonderful things over video and groups and doing all these creative things. And then when COVID-19 hit, that, I call it the great accelerant. It accelerated, I think, all of our plans to become more of a telehealth provider.
To allow for providers that don't have the audio video equipment necessary, and probably most importantly, members across our state, many of which are in very rural and remote areas that perhaps are compromised in terms of broadband access. We expanded that telephonic services allowance or benefit so that individuals can continue to access some of those really important services over the course of the pandemic period and really didn't have to compromise sort of their routine visits.
And this pandemic truly created the emergency that we needed to put our classes online. And before the pandemic, we were out every single week in 20 different locations throughout Maricopa County, helping the families with parent education and doing classes on low-income housing sites or in the libraries. And all of a sudden, we had to figure out how to put it online because we still wanted to ensure that families could tap into our free training for them. And our goal is to prevent child abuse and neglect, and we can't do that without supporting families and educating families on the best techniques for parenting and how to handle everything from potty training to working with teenagers.
We redesigned our individual emergency preparedness training that's specific for individuals who have disabilities to include what they needed to know related to COVID-19. And we were fortunate. We've had 3 trainings that are online, one just in English, one in Spanish, and one meant for youth. And we kind of created that content and put it out really as fast as we could because we knew how vital it was for the public to see.
Some of the other things we had to pivot on is encouraging mask wearing. After it was unpatriotic, now it's patriotic. I used the story of Einstein, who was teaching mathematics, and he had given a test, and the test was 25 questions, say, and at the semester end, he gave the same exact test to the class, and his teaching assistant said, "Mr. Einstein, don't you know you gave him the same test you did at the beginning of the semester?" He says, "Yes." He says, "Well, what's going to happen?" He says, "The reason I gave him the same test is the answers have changed." With COVID, what we knew in January changed by March.
Time went on, and around the first part of May, we saw the proliferation of COVID within skilled nursing centers. But what that did for the business model for our members, some of them took that and made it a huge positive. What they did was, you have a building, they have 70 beds. They had 8 people diagnosed with COVID right from the get-go in March, and scared everybody because you don't want to let it get into the rest of the facility, right? Well, they were able to isolate. They had plenty of PPE because they had a corporate structure that was able to funnel it from other states to them and really triage the whole piece. And what ended up happening was they turned their building into a COVID recovery center.
Well, again, the main thing we had to do to pivot was figure out how to serve those 200 people and do it safely. So doing that grab-and-go dinner, making sure we emphasize the distances with the volunteers, that was the major pivot we had to make.
In the area of masks, we did not have any masks. We were in dire needs of masks. And I sent a note on a Saturday afternoon to all of our employees and our board of directors, asking them, pleading with them, to see if there's any way we could procure some additional masks. Out of that email really ignited this motivation for people all around the community, both locally and nationally, to come together and start making masks for us. We called it the Mask Making Heroes campaign.
Instead of waiting till March 13th to restrict visitors, I would have done it sooner.
And I recognize now how our pandemic plans were hyper-focused on the flu, the bird flu, the swine flu, some of the things that we had recently seen, and didn't give the larger perspective that we needed.
You know, I think going forward, I'm not sure you can plan for a lot of these things. I mean, if you look at this situation, no one projected it. No one really thought it would be where it is now. So I think sometimes you just have to make sure that you're aware it could happen, but you really have to react based on what happens.
I wouldn't have done anything differently at Copa. We certainly, our team, our executive leadership team, I couldn't be more proud of them. They are stellar in the way in which they responded to the virus. We are very strong, we're extremely resilient. We came together as one. It did not matter to us which program you were in. If you were part of the Copa Health family, we took care of you. We made sure you had what you needed to be successful and to be safe during this time. And we continue to be that way. You know, oftentimes when you read literature around what really, from an organizational perspective, what propels integration, for us it was this crisis. It really helped us to come together. We have cross-functional teams. We really know our organization across all of Copa. And again, I personally wouldn't have done anything differently myself, and I think my team would tell you the same thing.
First of all, it's remarkable that Copa had actually, you know, thought this through and had a plan, and my hat is off to everyone there. But most of us had no clue, had no idea. And so it's understandable that perhaps that we had some days and perhaps even weeks of uncertainty and not knowing what to do, and you know, we didn't have a plan like Copa did that we could just pull off the shelf and say, okay, what did we say we were going to do? Because here it is.
We know for a fact that it's like a cycle that is going to happen. Sooner or later, a pandemic is gonna happen. If I can go back, I will buy more masks.
Well, I think with everybody else, I would have ordered more masks sooner. I would have ordered more hand wipes and thermometers for sure, because that's just part of our culture now. Is like many other businesses, we're doing symptoms checklists, we're taking temperatures before people come in, and so and masks are pretty much the day-to-day staple at this point.
So knowing what we know now, here's what we would have done differently. We would have more PPE in stock. We would have more staff available and ready. We would have more laptops. We would have better IT systems in place to handle the amount. We would have new routers to give to our employees at home so that their internet speed is faster. We would have had things in place like we have phone reimbursement programs, but we don't have internet reimbursement programs. So we would have thought of those things in advance. Now we're much more prepared moving into 2021 to think through those things and be able to have a workforce more at home, more in the office, and just this flexible environment.
We do see healthcare certainly changing its way in which we deliver the care. It will be more virtual than it was before. We've already seen that in the last almost 6 months, but we continue to strategize as a team on ways to grow Copa, and we certainly know that we can approach and have more members that we serve via virtual health and virtual capabilities versus in-person services. So that is certainly a movement for us here at Copa locally and of course nationally. Virtual capability certainly is on the rise, in addition to making sure that we are even more prepared the next time we deal with some sort of a pandemic. And there will be a next time, and so the good news is we'll be armored and ready to go.
I did test 385 of my residents for COVID using the nasal stick, and it goes straight up, you take a right, and just at the brain you stop, and it hangs around there for a while. That's very invasive. If we have an easier way of testing, then the asymptomatic is no longer a problem for me. And if it's easy to test for, then we can live with it as opposed to hide from it.
Coincidentally, we have not noticed or heard about any issues with testing positive amongst our guests. So it seems that maybe the homeless population builds up a little bit of a resistance, because it does not appear that there's been many cases in Mesa amongst the homeless of COVID.
Not knowing what's around the corner for us, I'd like to be able to add more into our playbook, a little bit more depth into our playbook on how to deal with different disasters. Because we don't know if we have another pandemic around the corner.
Latinos were like totally stigma. They never talk about mental health. And now they're super open, they're calling, they're asking. They're saying, oh, I feel this, why this is happening. And I think it's just on these, uncharted territories, something bright is coming of people saying, you know what, I have an issue with mental health. And now we're going to be able to take care of those patients.
Right now we're doing about 3 times the amount of telephonic services and about 9 times the amount of video telehealth services than previously.
Another fun thing that we're doing for Thankful Thursday for our employees and the children is that we're having the ice cream truck come today. So we've rented out the ice cream truck, and it's going to 4 of our different sites where the employees who are working, the ones who are off shift, are invited to come and get ice cream, and then all the children will be able to go out, and it's not going anywhere. It's not a field trip, but they're walking outside, and it's something special, and it's something very small, but we're trying to do those small token type things for our employees.
It's disappointing it took something like COVID-19 to create the national collaboration, but I do believe now, after having this event, that we are a lot better for it in the fact that we have developed a great communication system and have these national conversations and sharing of resources.
okay, we've been dealt a difficult hand here that we have no control over, but we do have control over how we respond to it. You know, the old saying, fool me once applies here. We'll have no excuses the next time around.
It's hard to consider the future after COVID-19 without being negative. There are still a lot of concerns I have moving forward. I fear that one population will be able to reopen without the other. The people who are vulnerable to COVID-19 are not going to be able to return to work and return to their normal activities. And I don't want them to get left behind.
How many people are out there right now, is what I'm wondering, that have kept their loved one at home because they're fearful of taking them to the hospital for fear that they may never see them again, or a nursing home, or an assisted living, and how many are taking care of them now, and when will that bubble burst?
The future is bright. I think that this pandemic is opening a lot of the stigma that the vulnerable communities have about talking about mental health. They're going to start talking a little bit more, being open about how they feel. And it's happening here at A Happy Kid.
I think one of the good things to come from the pandemic is that we have implemented a telecommuting policy for our employees to give them more flexibility. And I think that's going to be one of the key areas for employers moving forward is our ability to be flexible with our employees. And so now that we have a more robust telecommuting policy, we're seeing that our employees are having a little bit more of a work-life balance. It's helping with school, with our employees who have kids at school. So it's been a blessing in that respect.
You know, I think through this we've certainly understood the value that comes from community. Having a community of people that you can turn to during difficult times to learn from, to rely on, to help. Yes.
I did take a quote from the executive director of the World Health Organization. He said, we need facts, not fear. We need science, not rumors. We need solidarity, not stigma. And then I add, and with God's help, we'll get through this.
I'm most proud of our COVID cases in terms of it being statistically insignificant. For an organization this size, if you put it into perspective, the fact that we have over 1,200 employees, we serve over 13,000 members, for us to have less than 0.08% of cases across the entire organization, that is quite impressive. And that's something that when I lay my head on the pillow at night, that's what I'm most proud of at Copa.